Well, there is no doubt that our mental health has been tested in one way or another over the past year. Recent data from the CDC shows that about 40% of people in Michigan are reporting some sort of anxiety or depression. It's why over the past year we have continued to talk about mental health here at Fox 17. I'll be the first to admit I struggle with anxiety and OCD, and without the support of my therapist this past year, it would have been that much harder. And while the conversations just like that surrounding mental health are a great start, more needs to be done. So I sat down with mental health experts across the state to hear what we learned from this year and how and why we need to keep it going.
These challenges will be immense, from unemployment to helping our businesses get back on their feet to educating our children. It's not going to be easy, and it is going to take time. But we've been through hard times before, and we've come back. This will be a challenge.
That was March 22nd, 2020. And little do we know just how big those challenges would become, physically, emotionally, and mentally.
We know that every single person's mental health was affected, whether it be that it was the masks, it was the isolation, it was having to create a new way to work. It was my kids going to school. So we cannot deny that every single person was affected in the past year.
And the research backs that up. According to a poll, nearly half of adults have reported symptoms of anxiety or depression, up from 1 in 10 in 2019. Specifically, they found a 12% increase in alcohol consumption or substance abuse. And even more alarming, the CDC found that 1 in 4 young adults have considered suicide.
But I think it's brought to light, how much we need to make sure our neighbor, our brother and sister is okay mentally before it's always physical, right? How are you doing? Are you eating healthy? Are you getting sleep? Are you doing this? But our mental health affects so many things that ignoring it just is a burden on society. And I think that COVID has really shown a light a year later.
I try to be an advocate for it in any way I can. I know some people still they don't want to be open about that kind of stuff.
Kristen Schimel started seeing her therapist years ago after dealing with depression and anxiety. A hard step to take as a mother of 3, but thankful for the work she's put in.
And we still meet about every 2 weeks. And it has been such a blessing in my life to have that.
Meeting with her therapist virtually now, equipping her with the tools to navigate a year unlike any other.
And it's the work. It's seeing the therapist and applying this, these skills that she's kind of, as an adult, she's teaching me, and I don't know what I would have done if I didn't have all that time with her. And like I said, I think it's so important to know that she herself was weathering that storm with all the rest of us.
Pinera says in 2020, they saw a roughly 15% increase in overall inpatient admissions and about an 8% increase in total outpatient visits. More than 95% of those sessions were conducted via telehealth, changing the landscape for mental health services and accessibility for patients.
It really takes away that barrier, and you're meeting people where they're at, right, in their home.
The one thing that she always tells me is you can never pour from an empty cup. And that's very true. You might think you're doing the best you can, but if your cup is empty, if you're exhausted, if you're just burnt out, you're not doing anybody any favors.
But people need to know help is there, and it needs to stay accessible. When the state of emergency was declared in March of 2020.
Help us provide counseling and therapy for our residents whose mental health is affected by COVID-19.
The state was awarded a grant through the federal government to focus efforts on just that. And that's when they created the Stay Well program, a multifaceted program that has fielded almost 400 calls a week, people calling to reach a Stay Well counselor. And since May of last year, more than 1,300 people have used the Michigan Crisis Text Line. Since April of 2020, they have had more than 20,000 people call the Michigan Peer Warm Line, free support for people living with serious mental illness or substance use challenges.
There are ways that we can kind of improve and learn from the experience and move towards the positive. Maybe one of the things that will happen is we will have destigmatized the conversation about mental health. And we've been messaging throughout our work over the year, mental health is just as important as physical health.
it's going to be something that obviously doesn't just last from this year, but overall making sure that that continues to be something that is talked about and looked at, and efforts and research and money is put into.
Oh, yeah. I think that this pandemic obviously is going to change us forever in terms of how we think and our experience. And there's no doubt, and we're already putting in planning around sustainability, beyond the COVID-19 pandemic. We're building out a crisis line, a crisis and access line in Michigan that will hopefully be statewide. So I think these are ways that we're going to see ourselves pivot towards and shift towards a more sustained approach to just making mental health part of the natural conversation, making sure people have resources available to them before a crisis happens and when a crisis happens.
A silver lining, if you will, a wake-up call for many of just how important our mental health is and how we need to continue to make it a priority.
I hope it sticks. And like many things, Deanna, it was the hot subject for that moment, for that year, for 2 years, and then suddenly it goes away. So we have to keep it at the forefront. I need to know that my conversation can be with this person that, hey, it's okay. There's help out there. Let's find you some help. That's where I'm hoping we're going to move.
It was a lot for me to actually vocalize it to my husband, to say, like, I think something's wrong, or I don't feel like myself or see myself the same way I used to. And I know a lot of people that, they don't want to vocalize it. They don't, because if you vocalize it, then it's real and somebody else knows, but vocalize it to someone you trust.
That there's hope out there. A year later from COVID and the pandemic and the shutdown, I know a lot of businesses have struggled, families have struggled, people have lost loved ones, that all of us here who are still surviving and moving forward are doing the best that we can to take that burden off of needing perfection right now. We're all kind of like in this zone of just trying to get through the next day, the next year, the next month, and really to know that it is okay to reach out, even if it's just calling a friend or having a friend help you find ways to get the support that you need, because it's the time to do it right now.
It's been an amazing journey. It's not been fun, but it's been amazing. So,
well, be proud of yourself.
Thank you. I do try to, yes.
And there are a number of resources out there. We have all of that posted on our website for you, fox17online.com.